From Southern California, actually, Central California, and Alan came from Sacramento. And I didn't. By the way, I never told you about myself because I am a real doctor. I practice OBGYN. I've been in practice in California since 1975. I've been in Amador County for the last 13 years, and I operated this week and I saw patients. And I do have a degree in public health, and believe it or not, I trained in Berkeley, and I'm probably the only person that graduated from Berkeley with my political views. So there. And I'm a disgrace to that. Marcy, should healthy Long Beach be able to show PPO prices as from Blue Cross PPO?
Yes, as a matter of fact, we absolutely believe that PPO prices should be posted. Moreover, I'm working with Blue Cross specifically to develop a product that's quite different than the product that they have now, which is basically take a guess at what we pay, when we pay, take a guess at what you pay, when you pay. And so what I propose is that at any given time, if you were to go in, for instance, for arthroscopic surgery, Blue Cross says we pay $500 for your arthroscopic surgery wherever you go. Wherever you go. You bought Plan A, it pays $500 for your arthroscopic surgery. Your doctor charges $1,000 and you pay the difference. Or perhaps you find a physician who charges $750 and you're satisfied because you've done your research that the quality is excellent. You may want to go there. But you at this time have no opportunity to exercise your will because you have no idea if they pay, what they pay, when they pay, and what you owe. And the marketplace is absolutely nonsensical. Moreover, I think that you should be able to buy other products, Blue Cross Plan B, that pays $1,000 for the same surgery, for instance. So you could pay a higher premium, and Blue Cross could pay a higher amount of any given surgery up to a point, and that way you would have choice even in the catastrophic arena in terms of healthcare insurance. And, of course, now that you know the full cost, you can decide whether you want to use insurance or not. I'll use this opportunity to ask the question, how much do you think an MRI really costs? When I first asked my patients that question, their answer was $2,500 or $3,000 because that's what they see on their bill. But, of course, the truth is I can get you an MRI in my hospital for $375 cash in a minute. In a minute. And among the patients that I have in my practice, some of them actually have HMO insurance for their catastrophic care. I had a patient who had a radicular pain. She couldn't get the MRI because she couldn't get the HMO doctor to authorize her MRI. So she was home from work, couldn't work, horrible pain. I said, I can get you an epidural, but I need an MRI to see what the problem really is. I said, if you have $375, we'll get the MRI today. She goes, it's like I could have had a VIII. You mean I could go back to work tomorrow by putting out I'm already ahead of the game. She bought the MRI. She went back to work. She can't believe that her choice was to pay for all this insurance coverage, which actually obstructed her care. Hence, the idea of having a card is not care. And she exercised her free will and went and had her exam and was back to work. That's a productive, happy patient. Blue Cross at this point is already starting to exercise that in other states, and you'll start to see it in the state of California soon. Not exactly as I've suggested, but along those lines, yes. So they are starting to listen to us.
You could tell people what PPO allowances are for Blue Cross, Blue Shield.
Yes, they're starting to advertise that in various cities. What they're doing it for, their purpose is a little bit different. What they do is they say, we'll pay Memorial Hospital $3,200. We pay Los Alamitos $3,000. And then they want you to choose the hospital where you would have to actually pay the least amount. So they're using it actually as a means of guiding you to a hospital on the basis of cost.
With all of their networks, though, even their prudent buyer, which is...
Yes, that is coming to California. We actually had a discussion. It's in Ohio now, I think in Cincinnati and Cleveland. In various markets, they experimented with it, and they're moving forward with it. So I absolutely believe in that transparency as well.
It's like finding an airline ticket.
It's worse.
Right.
Yes, exactly.
Listen, I have one more question that's different, and it's real good. Why are, I think people don't know this, why are California insurance carriers allowed to threaten agents' commissions if the agent's group client uses certain high deductible plans in conjunction?